An expert in scurvy? There's always one or two in the audience. Well, I really have to thank Don Berwick for this anecdote, because it really frames the challenges that healthcare innovators and those who consume innovation face within the environment. Scurvy at one time was very common amongst sailors, pirates, and other folks who lived aboard ships longer than perishable fruits and other, rations allowed them to sustain, vital vitamins. And really, during the 15th and 16th century, the radius of exploration, the radius of travel that a nation could undergo was really much defined by how far its ships could travel. And one of the chief limiters of travel was the existence of scurvy, the ability to maintain the health and well-being of sailors, both commercial and for military purposes, on a long-term basis. For many centuries, scurvy was the main threat to health of naval crews. When the explorer Vasco da Gama sailed around the Cape of Good Hope for the first time in 1497, 100 of his crew of 160 died due to scurvy. Okay. And the disease starts off in very, very much benign form, but gradually progresses towards fever and ultimately death. And it wasn't until 1601 that a captain named Captain James Lancaster proved, when he was commanding a fleet of 4 ships on a voyage from England to India, that crews that were given up to 3 tablespoons of lemon juice, that's the lemon juice on the slide, received significantly better health outcomes when it came to addressing scurvy. Okay. Up to 40% of those on the ships who didn't receive the lemon juice actually died, and on those who did receive the lemon juice, only 3 died on a trip from England to India. So, an incredible advance. He documented the findings, and he submitted them to, the various scientific societies that were in existence at the time, and tried to share his innovation. Okay, and that was 1601, Captain James Lancaster. And interestingly enough, not much happened. Okay, citrus fruits weren't suddenly made mandatory on ships. Okay, there wasn't some broad mandate for changes to how we address scurvy. The experiment was actually duplicated in 1747 by Captain James Lynn, okay? And he did so under controlled circumstances. Remember, if you take a look at that equation there, it's almost 150 years later, okay? That experiment was duplicated, and James Lynn found in a random trial of 6 treatments for sailors on the HMS Salisbury that citrus fruits once again proved very beneficial to treating scurvy. An incredible find, okay? Duplicating what had already been a precedent, but incredible nonetheless. Not only because this was an issue that was vital to exploration, to the economic endeavors of an island nation, okay, who depended on its ships, okay, and well-being of its sailors was thus a major factor in its economic well-being. But 150 years have passed and not much happened. So, what do you think the next number is going to be in terms of my timeline? 1800. Okay, the British Navy begins to realize that maybe we should address this. Okay, and incorporates the consumption of citrus fruits into, its guidelines for how it addresses, naval travel. Okay. 65 years later, the British Board of Trade incorporates citrus fruits and other, related regimens into its guidelines, and this is for commercial vessels. So we have, from 1601, the findings, documented data, okay, proof of concept, if you will, duplicated again 150 years later, and then to 1865, 264 years for diffusion of this innovation, okay, from study to full adoption. Okay, and I want you to keep this in mind because it's really a lesson in terms of how we treat innovation within healthcare. The challenge that one faces in terms of disseminating results, inducing behavior, inducing actions, and how we work with the various stakeholders and challenges involved. Certainly, back in the 1700s, healthcare system in England is probably pretty straightforward, or less complex, at least it is compared to now, and certainly less complex compared to the United States. But it actually took quite a bit of time to disseminate. Over here I have a list of the various innovations that have happened outside of healthcare over the past 30 years. Incredible advances. Think about how your lives have changed within this time frame between the mid-'80s to current. The way we consume data, the way we consume and communicate with our colleagues, with the marketplace. Okay, how we work, how we interact with individuals within our geographic region and outside of it. Think of all the wonderful things that have taken place within this time frame. Okay, 30 years. Okay, and I'll make that a comparison to how long it takes for innovations to diffuse within healthcare. I've heard various statistics, okay, in terms of how long it takes a medical device or a pharmaceutical, technologies that have clear pathways of diffusion within the system. Okay, we have clinical trials set up, we have reimbursement systems, we have ways of understanding these technologies and indoctrinating them into our healthcare system. Anywhere from a few years for a medical device that has been proven, okay, to up to 17 years for novel research to make its way into the care setting, okay, let alone become a community centered. And for those of you who are working in health IT, okay, the timeline can be substantially longer. Okay, and it really has to do with how our healthcare system is built, what its infrastructure is for consuming and internalizing innovations. The great challenge for innovators within healthcare is how do we reconcile the pace of technology? How do we interact with a pace of technology development in terms of data collection, in terms of analysis, prototype development, and developing viable products and services to support healthcare with the pace of pace of innovation within healthcare, okay, to support adoption and diffusion. And that is the great challenge that I see amongst all the innovators that I work with. I have a good deal of my life within the federal government devoted to supporting innovations within the private sector. And by and large, this is the challenge that we face on a continual basis. This has significant implications for stakeholders. What is the market opportunity that is being missed as a result of these innovations not being recognized, even though they are being, driven by evidence and data? Okay, how do we design the new business models, the products and services within an existing healthcare system that, by definition, is very conservative in nature? Okay, policy and market forces are certainly strong drivers, but existing stakeholders by themselves are not culturally, organizationally, and strategically equipped to adopt, acquire new innovations methodically. Now, I know many of you are from forward-looking healthcare organizations, and I applaud you for having the infrastructure to, be ahead of your peers in terms of consumption. But what we lack in this country are nuanced pathways, a lack of a learning and diffusion network for understanding innovations, especially emerging technologies such as mobile health, such as predictive analytics, on top of the existing health IT framework that we're trying to build as a nation. It requires interventions, okay, and I say interventions in a broad sense. What I'm going to go through in the next few minutes are interventions from the federal government designed to help catalyze some of these efforts. But I'll submit to you that many of the interventions can be duplicated by stakeholders within the existing private sector. So what are we doing in terms of helping to encourage innovation? Well, first of all, there's an overall strategy involved, and that really is to encourage innovations that will be in support of the triple aim: better care, better health, and lower costs through continual improvement. And really that is the guiding principle by which we view innovation within my office, my team, and the department. It drives many of our grant-making efforts, and it drives a lot of the efforts that we're engaged in to support private sector developments. Okay. What I've designed here is a framework, a very simple framework for understanding how technologies mature and grow within the ecosystem. Everything from concept and ideation on the left-hand side to reaching that critical proof of concept stage in the middle, collecting the data to support that innovation, and then finally reaching a level of maturity to attain late-stage adoption. And what we've done is, as the federal government, is to try and support efforts by innovators to move through these various stages. identifying the needs and priorities, making them very clear and communicating them to the external world, helping to supply data and research to those who would innovate. In a few weeks, in early June, we're going to have our 3rd annual Health Data Palooza, making available hundreds of data sets within that are all taxpayer funded to innovators in an external environment to help support their developments. Initiating prizes and challenges to support early stage innovations. It actually took an act of Congress, okay, for us to set up this authority, but I'm proud to say that my office was the first in the administration to set up a prizes and challenges effort to support healthcare innovations. Establishing public-private partnerships, okay, and those of you who have worked with the NIH or their institutions may be familiar with these. Promoting testbed opportunities, a very crucial, stage within innovation development. Research and SBIR grants and low-cost loans through the Small Business Administration. And then finally, one of the crown jewels in our recent innovation efforts, the CMS innovation programs. Billions of dollars being funneled into, the private sector to engage in, pilot programs, long-term experiments, and trials to see what are opportunities to support better health, better care, and lower costs. And I think, as many of you are familiar with some of these programs, and have probably applied to them as well. Okay, so these are some of the, broad level efforts that we've engaged in to help innovators move through the various channels of development. We're not trying to pick winners or losers in this case, but we're trying to see the pipeline and try to encourage, a level of development that really is conducive to, the level of innovation that's needed in this country. And I'll submit to you that many of you in the private sector who are a part of forward-looking organizations have engaged in very similar efforts. Why support innovation? Because by encouraging and facilitating communication and collaboration, we can influence the magnitude, timing, and velocity of that innovation. Don't get me wrong, I'm not going to take credit for a lot of development that's taking place in this space. I think innovation is going to take place by itself no matter what. But at the same time, by encouraging and facilitating communication and collaboration, we can influence how efficiently resources are deployed, the level of market transparency, risk identification, the efforts devoted to finding individuals and resources within that ecosystem, because ultimately innovation is a function of time. Okay, I'm going to repeat that. Innovation is a function of time. If you are able to help those who both consume and develop move through that channel in as efficient a manner as possible, there won't be as much time lost due to high search costs, due to a misperception of risk, due to a whole host of factors that have nothing to do with the level of data or the efficacy or the ingenuity around the innovation. We're at 264 years that was lost, essentially, because information did not travel efficiently through the system, or the various stakeholders were not involved. Let us try and not repeat the mistakes of the past with regards to those who develop and consume innovation by trying to make it as efficient as possible. And I'm very proud to say that we're seeing very positive results both on the development side, the investment side, and those who are adopting and engaged in early stage programs. Okay? Yeah. Sure, I'm going to finish up in just a minute, okay, and then I'll take a few questions, okay? It's never a better time to be an innovator within healthcare, and this is really our view within the department because of the various policies that are helping to support innovation, policies that assume a level of innovation, that assume a level of development. All of the transformation efforts that the CMS Innovation Center is engaged in, from a volume-based incentive system to a value-based incentive system, supposes an infrastructure that currently does not exist. We're seeing accelerating demand within the marketplace, and we're trying to create incentives for development and adoption. And this is my final slide, okay, which is really a composite of the various, value-based reimbursement innovations, if you will, that we're trying to push forth. Patient-centered medical homes, accountable care organizations, bundled payments, readmission reduction programs. I think some of these, concepts have been around for quite some time, and finally we're getting around to deploy them as a result of the health reform, as a result of the Affordable Care Act. What this assumes, though, is that the technologies will be there to support them. Technologies such as mobile health, technologies such as clinical decision support on a timely basis, care integration tools, technologies to extend the reach of the physician or the care provider, and those that engage the patient and the family of the patient, and the extended ecosystem of the patient. The data mining and technologies and analytics that will support, these efforts. So we're not innovating for innovation's sake. We're innovating towards a higher goal, and ultimately it boils down to the health and well-being of this country. So if you take nothing away from this presentation, take the fact that what we're trying to do is accelerate the ecosystem, development of the ecosystem, and try to make it palatable for those who would develop and those who would adopt, in an effort to get us closer to that transformed health delivery system that we all deserve. Thank you very much. Sure. I have time for 1 or 2 questions, I'm told. So, please, yes.
Yeah, I basically have a comment regarding the innovation. Apparently, you're a Democrat, so you believe the government can facilitate innovation, but I don't think so. And also, innovation is not a function of time. Only in your case, the particular case, it is a function of time, but innovation is not a function of time in general. Innovation is innovation itself. So, and I think your model of how you facilitate innovation, helping innovator to accomplish things. One thing was left out is, if you don't know, then you can procure. And that's the problem with the government right now. Right now, the healthcare need a new infrastructure, because a lot of innovation right now is try to using the existing infrastructure to improve, to reduce cost, everything. But the existing infrastructure is not good. My question to you is, do you allow, on top of your, you have a timeline where you help, do you allow innovation of forget about that whole thing? Is there any innovation? That means you don't procure. Right now the complaint about people to the DHHS is that, well, they already know who they want to fund, and only those people can get funded. See, you already confine your thing.
So, in fairness to the audience, let me try and address some of the points you made so far. Okay, and I think I certainly appreciate your perspective on, and you make some very valid points. First of all, when I talk about innovation as a function of time, I'm talking about innovation in macro sense. Okay, not specific technologies or specific efforts by individuals or even organizations, but across the entire nation, across a large continuum. Okay, and what I see is a lot of stakeholders who are stymied because they cannot get around significant cultural organizational barriers to development, and that can only be helped from a time basis by helping to remove some of these barriers. Now, let me make clear, the federal government does not want to, artificially support innovations. What we're trying to do is, create bridges to private sector models for development. And we're not trying to support existing infrastructure as a status quo, but really experimenting to see what types of new infrastructure are created. That's the entire point of some of these transformational efforts that you're seeing on this slide, both from a reimbursement and care delivery standpoint, but also from a technology standpoint. It assumes a new level of infrastructure. It's really trying to incentivize, regional experiments, for how we can develop better care, achieve the outcomes that I think we deserve through, new mechanisms. Not all of these will be successful, but I think it's a worthwhile effort because it's some of the best ideas we have for lowering long-term costs. Okay, and if you want to talk further about this, I'm more than happy to stick around to talk about it. I love people who are passionate about what they feel about the space. Any other questions?
One more question?
All right. Thank you for your time.
Thank you.